All right, so good evening, everyone, and happy to be with you today. My name is Bilal. I've been asked to give some introduction about myself, so let me just make it short. My name is Bilal Aljoori. I'm from Iraq. I have degree in mathematics and computer application, master degree in computer science, and PhD in electrical engineering. I've started working in AI since 2006. And I had my master in 2009 and my PhD in 2016. I worked in Malaysia, Taiwan, and then I've been invited here to Australia in a program called Australian Global Talent, where they attract the highly profile researchers. And I've been selected among those who have been invited here. Today, I'm going to share some of our experience in research, particularly in systematic review. The reason why we are doing this systematic review, or why we select this topic, because before that, I've worked in applied medical research in AI, and I've done several clinical research in many hospitals in Malaysia and in Taiwan. And right now, I'm doing also some projects related to AI in many other fields. All right, so the reason why we did the systematic literature review, or we started our webinar with systematic literature review, is that all the researchers need to any researcher want to start their research. Okay, any researcher want to start their research, they have to to build a question so that they try to find whether this question has been answered previously in the literature or not. So the main idea is to ask a question to check if this question has been answered in the literature, and if not, then we are going to develop experiment or collecting data, conducting some methodology in order to analyze the data and come up with answer for this particular question. For example, let's say the vaccines, when they do the vaccine. So the question is whether this vaccine can, for example, help to protect patients from being, getting this particular disease. So in order to do that, we check whether the literature has answered this question or not. If not, then we will collect the data in a particular methodology, and then we are going to do analysis, and then based on our analysis, we are going to answer this question. So this is part one. And part two, we do the systematic literature review in order to synthesizing the academic literature and trying to come up with a comprehensive analysis about a particular factor, to study a particular factor. For example, we have vaccine have been studied in multiple samples, multiple studies, and they come up with different analysis. And our job is to come with comprehensive answer for a particular question about this particular vaccine. So in order to do that, we conduct a systematic literature review about all these studies, and then after we collect them, then we are going to analyze them and try to find answers for our question. So systematic review, from the name, it is a very systematic way of doing the literature review. The systematic literature review, I'm going to skip these introductions. So we have like three types of literature review, three types of doing literature review. The typical literature review, where we conduct a literature analysis on different literature databases. We try to include as much as possible resources in it. The other one is the systematic literature review, where the articles are going to be selected based on a systematic protocol, which means that we have to identify the databases that we search in, the keywords that we use in our search, the quality criteria, like if we wanted to include a study in our set, in our final set, inclusion, exclusion criteria, what elements that we are going to extract from the article, from the selected article, what is the reason that we did not select the article. So mainly, systematic literature review different from the typical literature review by making the process more systematic, which means we have a protocol for the selection. For example, let's say you want to buy a house. So you are going to search for a house in New South Wales, and then at the end of the day, you are going to say, like, for example, I didn't find, or I find, or whatever. So when someone asks you, did you search in here? Did you search in there? What was your criteria for search? Did you search for a particular range of money? Did you exclude for example, apartment? Did you include the commercial apartments? Did you include the houses in commercial area? Whatever inclusion or exclusion criteria. Did you include all of this? You say like no. Then there might be an options that we haven't select or we haven't include in our search. So systematic literature review, you can say like, okay, I search in this area and this area and this area. I restricted my search to the range of 1 million, for example, to, for example, 1 in 5. I know that in Sydney there is no such house with less than 1 million. But anyway, we select our options between this number and this number. We do this, we do that. And in the final set, we have, like, for example, 100 houses. So we know that these 100 houses, they are all having the same inclusion criteria, which means they are all in particular area, they are all in this price range, etc. So systematic literature review is the same. We have plenty of options where to search, where to find the things, articles basically. It's in multiple languages. We have articles in publisher houses. We have articles published in journals belong to universities. Articles published in a journal belong to publisher houses. So how we are going to select what is the appreciated database for this particular research, and how we are going to search in it. I know the time is not. I don't have enough time to explain in details, but I'm going to jump to the details of the systematic review, how we do the systematic review. So in the systematic literature review, we have 3 main elements. We have the protocol, the discussion, and then the conclusion. And in the introduction, in the protocol, we have the information sources, the study selection, search strategy, the query, the eligible criteria for inclusion and exclusion, and then the data collections. Information sources, we are going to, here we have like plenty of databases. All of them, they carry scientific articles from scientific journals. So the question is, are we going to search them all? In this case, your research will not end forever. I mean, you are going to search forever in order to search all the academic literature with your topic. That's why some people, they select, most of the people, they select a representative databases, and they have to explain the rationale behind their selection. For example, if you do all discipline, like for example, any discipline like medical, engineering, social science, you can select Science Direct, for example, Scopus, Web of Science, Springer, and also ProQuest. And then if let's say you are doing medical research, you can also refer to Science Direct, Scopus, Web of Science, and Midline, PubMed, and then NCBI. So these are the databases that you can search in. If you have social science, then you have to select other databases. So you have to identify the resources. You have to identify the resources in the first part of the protocol, which is the information source. Then the study selection, you have to identify like what is your research about. For example, you are doing cancer, for example, with AI. So you have to identify all the keywords related to AI, like AI and machine learning, or deep learning, or maybe neural network, or image segmentation, anything that related to AI. And on the other side, you have to select the type of cancer that you wanted to search for. For example, you want cancer, particular cancer, is it leukemia, whatever keywords, alternative keywords that give the same word, and then you are going to make it in a query. So you are going to do it this way, all right? And then after you select the database and then the query, and then you have to start the search process, and then you will get a number of articles. This number of articles may be sometime up to thousands. So you have to do some 2 iteration or 3 iteration of scanning. You start with title and abstract. You try to find whether this article fell into your scope or not. For example, the example that we have mentioned, which is AI and cancer. So from the abstract, you try to figure out whether the article have both topic or not. If not, then exclude the article. If yes, then include the article. Okay, so once you select you do the 2 iteration of scanning, then you jump to the next, which is the full text reading. And in the full text reading, you have a set of questions, that set of elements that you have to extract from the article. For example, in this systematic literature review, they extract things related to, for example, years of the study. They group them. Study design, is it controlled? Is it blah blah blah? Number of participants, duration of study. So all of these elements, you put it in a table, and then study by study, you extract this information. Then you are going to synthesize them into a group and make it into paragraphs, and then you start answering your question. All right. So there are plenty of examples in this slides. I will send it to Dr. Ahmed so that he can share with you. There are a lot of practical examples, things that is coming from articles that has been published. So part of it is from our research. You can have a look on it, and then it will help you to see like what are the things that we can extract, and then how we are going to group the information and make it into some paragraphs that is answering the question. So it will be like the body of the articles. All right. I think I've taking all of my time, but anyway, I'll try to jump to the end. Previously, systematic literature review required a lot of time, between 4 to 6 months, distributed between like 3 or 4 researchers. They are going to do the protocol, the analysis, the scanning of the articles, and then finding the research questions. But in the end of the day, you are going to complete one comprehensive article that covers the academic literature with a particular research question. All right. Nowadays, there are a lot of tools coming up with the AI, helping to do the systematic literature review, to form the protocol, to find the research question, to help you to scan the articles, help you to find some particular information in all article or a single article. So all of these information, nowadays there are tools, particular tools that can help you to do that, right? So I've left for you a table with the tools, some of the tools, and what to use in doing systematic literature review. And here are some recommendations. Later on, I will share the PowerPoint slides to help you, to do your systematic literature review. I wish if I have longer time, similar to this webinar I did previously, but it was like 3-4 hours, so that I explain step by step. But for now, I will stop and leave the mic to Dr. Aws to start with one of the AI tools that can help you to work on a systematic literature review. Thank you very much.
Thank you very much, Dr. Bilal. Dr. Aws, تفضل.
Yes. So, okay. Hello. Good afternoon, everybody. So this is Aws with you, full professor on global management, SPJ. I was working in Malaysia since 20 years and then jumped to Dubai, working with the British University 2 years, then came to Australia as invited from the government here under the Distinguished Talent Visa. And then they give me full professor under one of the prominent school here for the global management and then the data science and AI. And I came to Australia before 3 years and continue to be work there. So I'm working with the university as a researcher as well as a lecturer there to teach the master degree and PhD for the supervision. So let me just propose for you some of the tools that already follow up to date after the ChatGPT coming under the LMS. So let me just give you the briefing about the Bilal that already say, and me and Bilal and other members, we already working as a group since 20 years. And we are doing AI with the different disciplinary. One of the very prominent disciplinary is the medical research and healthcare. So we already just establishing this, we call it research cycling. Since 20 years, we already working there. So let me talk about the literature review, just giving briefing about Bilal already say literature, we already start with the start point element. He already presented in the systematic review, then keywords, how can be defined and put in the different search engine to be collect the article that we already related with your disciplinary. Then should be defined a query. This is manually should be doing. There is no AI tools can be do it for you. You should be collected, define the element, define the keywords, define the query, and collect the article. In the end, you should be filtering those articles and came with the final set. Till this stage, you can do the AI all those stage by AI. So let me showing to you one of the prominent tools up to date already used by the researcher and already defined by the universities for the researchers to be used there. So my presentation is not that present, will be give you some practical element to be followed by. I think some of you know this tool up to date. It's follow and can be used by the assignment, can be create the research, can be create the idea, can be used for anyone that you want to be used research for. What we call it, they call it Notepad LMS. So what is the differences between this tool and the ChatGPT and Gemini and other tools? Once you want to be go through the ChatGPT, you want to be do any research, any outcomes or any questions go through the ChatGPT, you will be try to be search about the overall resources of the internet. Some of the information that will be given to you, it's not that correctly, or maybe will be give you some uncertain answers that will be followed. That's why it's not that accuracy 100% can be followed by the researcher. So the researcher, they have some resources they want to be followed by. The way that will be followed in the ChatGPT or Gemini, the people try to be came with the what we
Dr.
call
Aws,
account.
Sorry to interrupt you. Can we expand the slide, please?
This one is not a slide. Is yeah, it's okay.
Okay, yeah.
So sorry, Prof. Ahmed. I think if you look at the top border of your Zoom, you will see two tabs. So at the moment, both presenters sharing their screens. So if Dr. Bilal would be able to stop sharing their screen, it would be great because I don't want to. Yep, that's perfect.
Yeah. So now once you go to the ChatGPT can be just attach the file. Once you attach the file, will be give you like summary, not just came with the file that already put in the attachment, will be give you from other resources. So what is the percentage for the answer accuracy, the answer that already came by the ChatGPT? Maybe will be give you 70% or less than. That's why it's not that perfect for any researcher to go through the ChatGPT or Gemini or cloud as well to be followed. It's not limited with the resources that will be attached. Then we'll be going through over all resources to be do it. But the Google already came with one tool and already free for anyone can be used. We call it Notebook Ala. So just typo in your Google, we call it this one. Okay. After you typo, just go through this and then try to be do the try Notebook Ala. Once you go through this page, then it will be open for you, but you need just Gmail. If you have Gmail and then you already insert the Gmail, then directly can be going through this software. So now this software or this one, as well as looking like ChatGPT, but will be created as a private sector for you. And then I'll show to you the powerful for this tool, how can be followed by. So now this is what we call it divide in two parts. This is, we call it features about the notebook. This is for the advanced. If you want to be learn more, you can open this and then can be take all those listen to be learn how can be follow this feature. But it's not that important up to date because you are big enough to be use this tool. No need from you to be going through that. This one, they call it privacy repository for you. If you want to be let me say I'm already do this research in one of my research group, and then I have other research. That means I'm create folder for each research. I'm already saving that. So if you want to be create the new tag and the new research, or you want to be used as a new, just tag there, create a new notebook. After you tag this, what will be do will be appear for you automated this one. So no need from you to be going through. Later I will explain to you this page. So now if you want to be defined, this tool, it's already divided in three parts. The first part, they call it resources. This is, we call it the mind. This is the mind how can be thinking this tool. That means all the resources should be upgraded there. What is the type of the resource? Maybe you want to be use the books, you want to be use the article, the filtering as Bilal already explained now. After you filtering, you have final set of the papers, you can upload it there or import all the resources. And then you have here looking like ChatGPT. And this is what we call it LMS. That means you can prefer the question, then the answer will become over those resources. It's not upgrade up, okay? And this one, they call it studio. This is the tools or the functions can be used there. We can create the audio, can be create the video, can be create the slides, can be create the quiz, can be create the question, can be create the taxonomy for the systematic review, infographic, can be create the data table, can be extract the information directly. So no need from you to do a much reading from those articles, especially if those articles is long pages. So now, how can we use those 3 pages? I will give you the briefing. Briefing is very enough. If you are just lost like 10 or 20 minutes from your time, just one time, you can go through and try and error from those. Then you can understand whatever, and then you become professional to use this tool. So now let me go through the sources. How can you can add your own sources. If you press this, add, then will be appear for you this page that already came over from the first one. I'm already planned for this software. So now this one already divided in 2 parts. So this one is automated, can be searched for you. No need from you to be used there. You can just go down, and then here we can upload from your PC directly. If you press this, you can see I can be what we call it, choose any paper there to be followed. I will choose one paper later from this pick, and then we'll be showing to you some example how can be used. Then if don't have paper, PDF, you can go through there. You can put just the URL for the website. You can see URL can be going through there and insert the URL. Then other, what is the type of the things that will be followed? You can go through the Drive, Google Drive. If you have any file in the Google Drive, you upload in the Gmail, you can download directly from there and try to be attachment there. You can see this is the PDF in the Google Drive for one of my lecture in the statistics. I can be called and then we'll be going through there. Okay, the others, what you have? You have the copy text. If you have the text from reporting or something else, you can just text there and then you can insert it. So all those you can using as a add resources. It's very easy, just drop and then you can do it directly to be add there. Okay, so all those resources can be appeared there to be followed by. So let me show you one example how can we do it. I will just going through the upload file. I will upload one of my papers. Wait, let me go through there. Sorry. Let me show you one of the PDF to be follow. Okay, so I will upload this. Okay, you can see now I'm just select one paper as PDF. You can upload the book, you can upload whatever you want to upload. After you upload it, you can see it's appeared there. You can upload the other paper. What will be happen? If you upload this, just press the PDF, then will be appear for you all the information. You can see, give you the briefing or summary about this information directly. What happened to this PDF, right? So once you press there outside on the right, the things will be get done and the reference there. So you can do it many things. You can remove the resource, you can rename the resource. So regarding to the rename, I can be rename as well the notebook. Let me say now I want to be put all this file under my name, under Aws, okay? So I can be just change the name, everything will be saving under Aws. Once I close, I will back again, will be appear for me all the file, all the resources, all the works that I'm already doing, all the functionality under the Aws folder, okay? So once you upload all the references, will be appear here, it's unlimited resources. You can put whatever you want to be do. Once you already selected 10 or 20 or others, and then next time I will add other 10, it's okay. For free can be added. So once you add all of them, then the resources will be ready for you. That means this size in the left side for the resources. You can upload whatever you want to be uploaded there. So once you have this, you can go there to be asked any question you want to be do, looking like the ChatGPT. But what is the differences? As I say, the difference is there. Once you raise any question, the answers will be limited by those resources, not up. It's not go outside to be give you some, and then will be cited for you those what we call it references that already follow by those sentences there. So that means this one looking like ChatGPT. I think everyone they know how can be do the prompt for the ChatGPT. Okay. So after finish this, we can go to the right side because we have limited time to be shown to how can be deal. I can be now, let me say I don't have time to be reading the book. I don't have time to be read this article. Can be changed the article to the audio? Yes, can be changed to the audio as podcast, right? I will show it to you how can we do. Just press, that's it. You can see now. I'll press it, then will be try to be processed there, will be generate for me the audio. And then will be take a minute, okay? Depend on the size of the PDF. If the size is already high sizing, then the changing or convert will be take time to be do it for you. You can do by the video as well. You can see we have video there. Will be give you the video, the podcast, as well as explanation with the different volume, okay? So let me go through the other things. Now we have audio, we have video, we have as well as can be create the mini mapping. What is a mini mapping? Mini mapping, that's mean will be create for you the taxonomy. As I showed to you in the PDF, you remember here what we call it, we have taxonomy there after query. Because after query, we have final set of the paper. After that, we should reading all the articles as Bilal already presenting. After we reading, we need to make the groups and then we create the taxonomy. So no need from you to be do that. The software can be created for you. That's why this is a new things can be do it. Let me show you. I want to be create the taxonomy from one paper or maybe from all papers will be create like the taxonomy for you. I'll show to you how can be do. Just press. You can see it will be generate for you the taxonomy. You can do multi-functions. I will call video, call the taxonomy, call. You can see now the taxonomy already done. I will open the taxonomy. The taxonomy appear for me. Once you go to the PDF, we don't have this taxonomy, but it's make it easy for me to be understand the paper. That means if I'm create the taxonomy over all the papers, then can be give you the briefing about the mining, and then will be give you what is the idea that I can be going through, right? So this taxonomy is not give you just one line or one layer. You can see depend on the taxonomy in the literature review. What we have different layers. So how many layers already came with me here? It's one. I can be came with the second. You can see now will be give me sub-taxonomy. Then I will press there, will be give me sub-taxonomy from there. I will give you the sub-taxonomy from there, sub-taxonomy from there. That's why the general taxonomy for this paper already there. Can be now download this one as an image. You can see now all the image will be appear for me in the taxonomy. Then will be resizing. I can be going through those taxonomy in order to be understand more will be showing to me. How many layers already present here? 2 layers for the taxonomy. Once you read the paper for this methodology, I think will be spent like 3 or 4 days to be came with this taxonomy after you understanding the area, right? So, but now within Press, we can create the taxonomy and read this one, okay? So this is one of the feature, very big feature, and then can we do it? You can now minimize that. Now I will minimize again. So the taxonomy already saving there. You can see now about to install the audio in the generation because it takes time because the PDF is very sizing, right? Then what is the other feature? Now we already learned how can we do with the taxonomy. We call it mind mapping, right? We can create the slides. It's very important because everyone needs from you to do the presentation in the end. You are a researcher, right? So you can call your thesis here or your project or your, what we call it, final year project or your documentation. Your PDFs will be created for you, the briefing slides, and then will be generate for you also the slides. But once I open this or pressing will be take like 20 minutes to be create the slides. But you can do it by your own. You can upload your small video and then can be create and change to the slides, okay? Audio, video, can be do the mapping and can be do reporting. Reporting is very important. Once I press the report, will be appear for me one tag. This tag is differences will be followed by. Create your own.
العفو دكتور أوس باقي لك 30 ثانية.
It's okay. This is very important.
بعد دقيقتين خلينا دقيقتين. الموضوع حلو.
مشوق جدا ودكتور أوس يعني الفكرة قاعد تقربها جدا. أنا أعتقد نساها دكتور يعني فتشب دقيقة.
Okay. So this one, it's already what we call it. We call it the tag. I can be going through this tag. We call it create your own brief document, study guideline, blog post. What is the differences between them? It's very important. And forgot the down because it's just format here. But here, once you go to the create your own, that means will be create their own idea. Will be do the report, summarize for you, everything will be followed by. So let me just press this. You can see now. Once I call this, will be now select the language. You can select the Arabic language, can be select whatever you want to be do, right? But what you want to be do the summary. Let me say I want the research gap, right? Research gap. Now in English, then generate. That means this is a prompt, right? But will be created as a report based on the resources that you already uploaded, right? Then directly will be created for you. You can see. And then will be saved there on the right side. I think will be take a bit minute. Let me just going through the other reporting, okay? So that means this one will be created based on prompt. Here will be do brief about the document. Will be give you a briefing, but depend on their thinking. Because we'll be thinking for you, will be try to be do the summarize for you as a briefing, right? Once you go there, will be give you guidance. That means we give you guideline about this folder. That means now will be summarized for you and then will be give you the guideline from A to Z. Here, the last one will be create for you the paper. This is what they are looking by the people, right? Because can be create for you the paper introduction, will be give you the abstract, will be give you the conclusion with their own references directly based on that. Let's say if you have 100 PDF, can be create for you like conference paper or journal paper, and with their references directly can be create for you there. Once you press this one, okay? But it takes time, you can see, once I want to be generated. And there is other things, this is the reporting I'm already showing to you. Now we call it a flashcard. Flashcard can be created for you the question to be test you, whether you already understand those PDF or not. Let me say I will create the questions now. Flash mapping. Now will be create for me a set of the questions. You see, now the strategy follow by this. Okay, later I'll be showing to you. Then will be create for you what we call it the flashcard. Flashcard, that means will be set of the questions one by one. Once you already answered in the right, then will be jump to the other question. Once you answer this, will be jump to the other question. Okay, then will be test whether you already understand or not. Quiz can be create. If you have PDF, you want to be create the quizzes for the students, can be do that, and then you can saving the quiz in the Excel sheet with their answer, and then will be follow. This one is very important. Infography. Infography will be give you the figure out about the idea. We call it a graphical abstract. Then once you press this, will be give you graphical abstract. Okay, so those are also very important. Once I press, will be take a minute, then will be give you infograph. That means from A to Z, input to the output. Well, but will be virtualized for you the idea. Virtualize will be give you what is the problem, what is the answers, what is the gaps, how can we fulfill this research. That means the idea we can going through the infographing. Data table, if you press this, will be try to be do the analysis for all PDF, and then we'll be pushing under this data analysis. We'll be do the table that already presented by Bilal, you remember, in the systematic review? This one already injected there. Then directly can be full by all those resources by those tables. No need from you to do anything, just press. Upload the references there and try to be pressed there. If you want more resources or more analysis, you can just write many questions, then the analysis will become to you there. I think this is enough for me because we don't have time to be going through more, because maybe in the next workshop we can do it more about this, or maybe we can do face-to-face workshop. We can do it practically. We can bring your laptop, we can reserve one room and then try to be do together and then upload some PDF. If you upload some PDF, you face some error, then we can see, and then together we can work on this.
Right.
Okay?
Right. Thank you.
Thank you very much.
Thank you very much دكتور أوس. رائع جدا. إن شاء الله بالمستقبل.
Dr. Ali already donate few minutes of his presentation, by the way. He said.
Sorry, because I'm just talking very fast.
تفضل دكتور علي.
بس انتظر دكتور أوس stop sharing. So
I will stop the sharing. Yeah, okay.
Could you please confirm if you can see my screen the next few seconds?
Yes, all good.
Yes.
Yep, perfect. Thanks so much for that. And thanks for the Iraqi Australian Medical Association for this amazing and generous invitation. So my name is Ali, as mentioned at the start of this webinar. Thanks so much for my colleagues who presented all these different platforms that contribute directly to the medical research and research in general. In this particular part, I will focus more about the ethical implication and also data privacy. So be with me for the next few slides. Overall, I'm just going to try to, yep, that's my second slide. Okay, so everything should be working now. So overall, I'm just going to talk about the growing use of artificial intelligence in medical research, specifically in medical research, and how important for us to integrate this AI, especially when we talk about large scales of data collection and data analysis. But at the same time, I also will touch base on some major concerns that can be seen when we use AI as a platform to support our data. Finally, I will integrate the ethical implication on how we would approach AI, or at least AI-driven research. But before jumping into all these details, let me start with the acknowledgement of the country. So I wish to acknowledge the people of the Kulin Nation on whose land we are gathered today. And I pay my respect to their elder past and present. Today I'm presenting from Melbourne, which is basically the Wurundjeri people land. And also I would like to acknowledge our amazing civilization, Mesopotamia, across thousands of years, when we discovered and established amazing innovation for human being, including writing, applying law, building exceptional cities with unique architecture, definitely measured with the precise mathematics analysis and looked at the sky, and we built different approaches toward the astronomy. But for this particular presentation, my focus after 6,005 years later, I will focus on 3 words in this, and which is part of our innovation: writing, law, and mathematics. Now, start with writing. As mentioned by our colleague Bilal, the structural components of any published work usually rely on building a research question, a scientific research question that's aiming to build some sort of health or supporting investigating health or disease issues to improve diagnosis, looking at better treatment, and of course, better patients' outcome. In general, we have research questions articulated around the specific aims, and clear hypothesis in the background, which is rely on the gap in the literature. Then after that, we move to the next part. How would we be able to approach this question and what we need to do to address or answer the question by building a method section structured from the ethics approval, number of participants or samples. Then after that, the way that we do the analysis and the statistical analysis to present our data, which usually the following section. So presenting data or the findings, basically the results section, showing whether they are significant or non-significant. Then after that, the meaning of these results usually range between the starting of the discussion parts, recommendations, and conclusion. Once we establish these components all together, we can put it together as a paper. Then after that, we submit it for a journal and we keep waiting for their feedback with their critical review. Then after that, we end up with producing a research output, reviewed, confirmed, verified, and showing the general community, in addition to the medical and scientific research, what exactly we discovered in this output. Now, this traditional way, it's been going for quite some time. But for during the recent last few years, probably the integration of AI, or let's call it AI-driven innovation, played or contribute significantly to the way that we look at our data or approach our research questions, collecting data, not only in research, but also in other clinical setups. And the unique thing about the use of AI also help us to uncover many patterns that were previously difficult to see or to detect. Probably one of the most famous cases here in Melbourne was like a couple months ago, that's using AI tool that has been published on ABC News. AI tool used to detect tiny brain lesion that's induced seizure in pediatric cases. There's not only one case, multiple cases. And from this published article on news, there is a nice radiographic image of the brain. Just to give you some orientation, this is one of the imaging techniques. We call them magnetic resonant imaging, which is, or in short, MRI. And you can see here, this is what we call it a sagittal or parasagittal. This is the head, the overall upper part of the head. Here you can see the eye, and these are parts of the brain. For the clinicians, for the diagnostic methods, it's always coming back as a normal with no significant changes into the brain. However, processing this data set, this DICOM data, into an AI machine detects small lesion. And I would highly recommend for you, if you have a couple of minutes, just check it on Google and see it. And literally the lesion, it's literally the size of a blueberry, sitting within the frontal lobe of the brain. Now, of course, surgical intervention being conducted, patient's outcome much better compared with the previous that. So AI contributes significantly, again, in research and in clinical applications. So this growing of AI practically escalated quite fast, quite significant, probably much faster than what we might be able to handle. This potentially or possibly, that's only my personal opinion. But what we see here, we see more accuracy, more data can be analyzed, more DICOM data or imaging across the brain and other regions. But the other limitations coming again, which is the ethical implications surrounding the data that we are using or uploading toward our AI platforms. Now, while I'm preparing this presentation, I come across Gemini reports. Probably many of you already seen, but I just thought to share it with you. Now you can see how smooth the movement of this robot. So they are not just robots. You basically have a discussion with them and ask them to do things. And this is literally my favorite video, because these two arms basically designed to rearrange everything on the table. So whenever things are messy on the table, They just memorize it and they put everything back. Remind me, or possibly having one of them in my son's room, which might make my life much easier in the future. So overall, we established that the involvement of AI in our research quite strong and effective. But now let me highlight one of the key points, which is the ethical challenges that we face as a result of using AI. And we can separate them into two primary components. The first one related with the privacy or data privacy concerns. The second one related with the security of the data. Now, security of the data, it doesn't have to be linked with AI. It could happen to any platform. Unfortunately, most of my personal data already online, thanks to Optus. So we have possible risk of security or security risk on data breaches or cyber security, cyber attack that's occur with AI or without AI. But the primary thing that I would like to highlight here is the privacy concerns of our data. The moment that we use AI as a platform, that's basically going to use some data from patients, even if they are unidentified. So when I do my research, I have a couple of MRI cases, CT scan cases, whether traumatic brain injuries or control, they're already unidentified. However, the possibility of getting them identified again or re-identified again impose significant risk. And let me explain a quite important topic here, which is the re-identification. I remember there's a nice story about the re-identification, one of the conferences when we saw a couple of case studies, and one of the committee members say, it is possible to identify the unidentified cases. So we refer to one of the cases that we presented at that time. And the case was a specific injury, specific head injury that had a specific outcome in a specific hospital following car accidents. And one of the committee members say, look, how many car accidents caused this particular injury that's been published in the news, that you already published, and you possibly shortlist the number of cases into maybe 5 possible cases, or maybe 2, or maybe 1 person only, and you would be able to identify the unidentifiable or the unidentified cases. So when we move from human ability to AI ability, which basically much beyond our ability in gathering and processing data. So this when the actual concerns about the privacy will come up. The second part also related with our research when we conduct and we collect data. One of the key points for our ethical obligations, we have to source consent from patients or from participants. And most of these consents saying crystal clear, the data will, your personal data will be removed, it will be unidentified, your data will be processed for results or for research or for whatever. So the word processed, without making the crystal clear, that will be processed in an AI or another platform that's had the potential of re-identifying, that might consider as a breach and concerns or further concerns to the privacy. So to make it a simple way, what we normally conduct, we collect our data, whether from patients, from participants, it doesn't matter. We have, as mentioned by our colleague, we have systemic review, we have structure of our data. Then after that, we process it for our research. Then we put our findings into a journal or publications as a research output with anonymous or non-identified persons. Only we have the output or the data. However, when it comes to the use of AI and I put my data, put all the raw data into an AI to get, let's say, a better data analysis or better way of showing where is the significance, where is the non-significance, or faster, easier workflow to evaluate bigger data, that's the issue will come back. Does this AI, which represent any platform, I'm not really specifying what sort of platform, honestly, sky is your limit, and definitely not ChatGPT. But there are heaps of platforms that can be used, and you can share it, or that's literally you can share, so transfer your data that's collected from patients to or from participants to a platform, to AI platform. Now, this is your data, and AI respond to you with the response that you want, and you moved on with the research output. However, this data is still there. And anyone else outside these circles unable to identify. However, AI still able to identify. Or this data might be used by other platforms, or other, even AI itself can produce a new research output, or other researchers that might get access, because if someone asks how many cases, whatever disease, it might coming back because it's based on real data. And the worst case scenario is basically the same concern, which is the cybersecurity issue or cyber attack. Some data might be basically taken away from the AI platform. So the risk is there. And I think we need to be more careful, especially with the handling of healthcare data, particularly related with the possible breach or possible leak to the black market. I'm not referring to advertisement or marketing that's managed. It's way beyond that. So the primary question, we have a great platform and we have potential risk. The biggest question, what should we do? Should we take the risk? Not. Well, practically, and in my work, in my research platform, I do apologize, I'm looking at the time. Probably we still have maybe 1 or 2 minutes, so I'll try to finish as soon as possible. But just to make it easier for everyone, took my research area as an example by highlighting machine learning and deep learning. Now, the introduction of them, both of them based on AI analysis, but with different level of analysis. The deep learning, it's more advanced way of analysis, especially with MRI and CT scan and other imaging techniques. So give me more context. And I'm looking at the TBI models, which is traumatic brain injuries. And these traumatic brain injuries can be induced in any trauma, external trauma to the brain. And if you don't know where's the brain, so this is the brain inside my head. Luckily, we know where is the brain. And also the reason or the cause of the trauma, it doesn't have to have fracture, which is misconception. So if you have fracture, you have a trauma. No, it's always fracture. Sometimes without any fracture, you might have a trauma as a result for falling down, accident, sports injuries, and unfortunately, domestic violence, another major contributor to the traumatic brain injuries. So machine learning, if I'm planning to use it, or the way that I'm using it, using a platform that's connected to my institution, because my institution obligated to have contractual obligations. So they have a contract with this company, making sure where is this data going to go, where it will be saved, how you will process it, and how you will remove it after finishing. So these kind of legal actions can be taken by your institution, which is highly recommended to follow. That's what I'm doing, and that's also I'd like to share with everyone here. So definitely making sure that this is a legitimate platform and you can use it. You can upload your DICOM data, making sure everything is accurate, safe, without any possible privacy breach. So to summarize everything, definitely the data should be secured before taking any steps, and that's my personal opinion, taking any steps toward using any AI. Transparency to use AI as a platform, because AI will learn from you. So to get the feedback or response from AI, you have to teach AI what you need exactly. So the transparency is quite important. And an example for that, if I have 200 TBI cases, traumatic brain injury cases, and I select 10 of them, and I say, this is the machine learning. Okay, use this 10 cases as a representative for the 200. So, and I select in a biased way the worst cases. So that will build a wrong generated prediction data from AI. And also, no matter what I'm doing at the moment or in the near future, definitely keeping the human oversight in decision making. Machine learning, deep learning, AI should not, as we speak today, maybe in the next whatever years, should not replace any clinician or legitimate research, especially because the priority will be patients' welfare and across all platforms. So overall, the recommendation, it is good to use platforms, but equally it is important to consider many factors related to the use of AI. Apart from that, I'm more than happy to provide more context in other platforms, and feel free to communicate with me. And if you are interested in a study traumatic brain injury for your master degree or PhD, I always do this advertisement, sorry. You are more than welcome to communicate with me, sorry. Again, thanks so much to the Iraqi Australian Medical Association for this invitation. Thank you.
شكرا دكتور علي. شكرا. التقديم اليوم كله رائع، كل الدكاتره ويانا. اريد انا اسال سؤال، استغل الموقع واسال سؤال دكتور علي. ويا المشين ليرنينج، يعني اكو ماشين ليرنينج من دون ان تتصل بالانترنت؟ يعني انا جاي اريد اشتغل على الماشين ليرنينج فور تيستينج، لو الا تشتغل ويا الانترنت، يعني ويا الاي اي بلاتفورم.
بالنسبه لخبرتي المحدوده to be honest with you, because I'm working on heavy DICOM data across multiple data and I want to compare between them, maybe using a free server or IDS7 still limited. That's why I have to rely on internet uploading data and get that results. I would recommend to ask probably Dr. Aws or Dr. Bilal to contribute to the different platforms. But for my research area, that's why I have a clear contract that I had to sign, similar to my institution, to the provider. Everyone have to agree before even taking any steps. And this was honestly the very first question for my ethics application. Once we finish this contract, making sure the data is preserved in a particular platform, then we start working on it. So for me, I have to use online. I have to use online.
والسؤال الثاني، انت مستعد للتعاون يعني بالمستقبل؟ لان انا عندي بحث عن الماشين ليرنينج جاي اشتغل عليه، بس حتى
Definitely, with no hesitation whatsoever. You have my email. You are always welcome, and all my colleagues here always welcome. I'm still rebuilding my lab. So my lab used to be at Swinburne University, also in Melbourne, but I just moved probably a couple of weeks ago. So even my page is not up to date yet. But yeah, I'm currently at Monash University. So next time, if you are in Melbourne,
I'm in Monash.
You know where you. Monash, you're Monash. Oh,
yeah.
Wonderful. Okay. So let's have a coffee. A Clayton campus?
No, we are in the rural in Monash, Warragul, very close by. 1 hour.
Gippsland, Churchill, Gippsland. Yeah, I taught year A for 4 or 5 years. Sorry, I'm not going to tell you.
خلينا نفتح باب الأسئلة. If there is any question, of course, Dr. Ahmed. تفضل.
دكتور عصام، إذا أعقب لك على نقطة الديب ليرنينج.
دكتور بلال تفضل.
طبعا okay, I'm teaching this subject in my school, deep learning, machine learning, all of these subjects, and I used to implement these approaches like since 2013. What I believe is that you can build it in-house. Most of the deep learning approaches, you can build it in-house unless the data is a few gigabytes of images. Maybe for that case, you need some GPU. Also, you can still have it in-house. It's a little expensive to buy a GPU, maybe $6,000-7,000, but
8,000.
Yeah. I got one Quadro P6000. I got it as a gift from NVIDIA. They give it to me in 2019. It was about 7,000. So the high-end GPUs are this range, $6,000-7,000. It can help you to run experiment of, for example, a few hundred images in 5 to 10 hours. But if, let's say, your institute have like some protocol to deal with these cases, why not? You can go with the directly to the cloud or with some platforms and see the terms and conditions that they have, and then get approvals. I myself, I prefer to have my own, development in-house, because, it's easier not to sign all of these papers, all of these documents, because you are disclosing your data outside. So implementation is possible, but it depends on the data size.
شكرا جزيلا إن شاء الله نتواصل.
Sorry, can I ask a question?
Yep.
تفضلي دكتورة ميديا.
First of all, thank you so much. والله أروع محاضرة يعني Dr. Bilal, Dr. Ali and Dr. Aws. But I don't know how everybody felt. So I'm a Ghani specialist. But it really felt for me that you were going multi-million miles an hour. I'm really interested. It was really good, but I don't feel like I'm that advanced in that, but I'm very interested. So in terms of like future webinars, I think for me, I would like, the very first level to start with, and then we build up. I don't know how everybody felt. Like there is so much to learn, but I feel like I'm not that far ahead in it yet. I felt like I went halfway through and I'm like, what has happened? So I feel like we need to arrange maybe a webinar for beginners, and then we can build from that. I was very interested in Dr. Aws's one, but it's like I'm not familiar with the whole concept, so I need to learn to be able to start using it. Are we using it as a meta-analysis, or are we using it to basically learn about a certain study, or are we using it as a tool for us to search for it? So I felt a bit lost.
Yeah. Doctor, I'll probably help in answering this query. But let me first pass great appreciation, great thanks to Dr. Aws, Dr. Bilal, and Dr. Ali for this exceptionally great presentation. You managed to change a dry topic into a very vivid and a very attractive and a very informative session. Dr. Ali, special thanks for you for joining the acknowledgement of the indigenous people and share it with our Iraq civilization. This is great for us, believe me. And this probably exhibits what we are after from all this group work we do. We're trying to get this an example for us. Thank you very much. Now, Doctora, I will have a question. But last year, we have several meetings with Dr. Aws and Dr. Bilal to establish a structure for a course on AI, right? Now, what Dr. Aws mentioned today can apply to any other field, right, Dr. Aws? I don't think all these platforms or all these applications are limited to medicine. So this can be a door that we can go through for all other disciplines, medical, engineering, even humanitarian studies there. So probably the starting point is this rather than a webinar approach. We built up a structure for AI for all, like what we do in the Academic Association. We have Science for All. We have a second monthly session. We call it Science for All. So here we can put this as AI for all. And this can be lecture weekly, second weekly, but we end with having a very good introduction to the beginner, and also this can be helpful for others. So I promise you, we will try to finalize. Dr. Aws and Dr. Bilal, this, and Dr. Ali will help us, Dr. Isam will help us from the medical aspect point of view on the use of these applications. Correct? The Dr. Aws, remember that last year, that we have interruption because of a couple of things. My question to you, Dr. Aws, is it legitimate to use these tools in research? Is there any issue in terms of legalizing this, say, against plagiarism, for example? You are muted.
Sorry. I think you can't. Thanks for this question. Yeah. I think you can hear my voice, right?
Yeah, correct.
Yeah. So, yeah, it's eligible to be used because you are not doing the research from A to Z using this tool. This is, we call it decision support system. That means will be support you through the research. So let me say if you have like 200 papers, you want to be understand the pattern for those papers. So what is the general pattern for those papers? How can we create the idea? You need to do the taxonomy for them, right? So that's why you'll be spend the time looking like months or maybe 3-4 months. But using this tool can be do the taxonomy within 5 minutes for all of them. That's why you'll be saving your time. In the end, I can create this taxonomy after 6 months if I'm reading without AI. Do the analysis, everything would be done by 9, and then we can do it by then. Once I take with this taxonomy, I can choose my line where I should be go to the research. Will be guiding you. But you are not using as a term directly copy paste and try to be published and then will be followed by. No, this one they will using to be analysis. Will be what we call it. Will be give you like first testy analysis. They call it in the research. That's mean if I want to be do some idea, where is the people already done? What is the point that already stop it? From where will be start? That's mean will be give you the guideline, the mapping, general mapping. How can we start and where is the trend lines that I should be going through? That's why we'll be give you looking like this. But I think better, but this is my perspective, to do the workshop how can be used in the research, those softwares. In terms of research, you are not specific for medical or in general research, okay? And what is the eligible part that we can came with, and what is the eligible part that can be prevented? I think this one can be give benefit for the audience.
So, thanks.
Yeah.
But we still need to have a sit in that Turkish restaurant to talk about the structure. That's not enough.
Can I say something, please?
Okay.
Sorry. Now, Dr. Madia, to be honest with you, similar to you, maybe your experience in AI much better than mine, simply because I don't know how AI work. That's the simple way to say it. I've read about it, I've looked around and see lots of resources, data collection, analysis, blah, 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 all of them. I have no idea what is the depth of AI. However, I took the very first step by looking at the actual cases. I've done all my analysis in the very first few papers on actual DICOM data, so DICOM data on IDS7 or free CR4, which is a simple software can be used on your laptop or on your device without any internet access. And that's part of the ethics. But then we saw all these tools, and honestly, it was surprising how many tools we've got, the capability of them. So I would definitely, that's my personal opinion, I would definitely be careful before stepping into any of these tools. I would spend more time about understanding what exactly the depth of these AI. I'm not saying we're not going to use it. It's already there, and we are using it. But some limitations like, okay, I'm going to polish my CV to put it on ChatGPT. That's a disaster. That's a huge issue. Even it's easier, but it's not always the easy thing. It doesn't have to be correct way. So yeah, that's my comment.
Thanks.
There's a question, is some tool work better with medical database, example PubMed?
I'm trying to write the answer.
Yeah, he can answer.
I can answer.
Okay.
Yeah, both of you can answer. Yeah.
So,
Okay, you can go to Tariq.
so PubMed is a nice platform for many publications. I've used it as a way to sign up for subscription, and it will send you a notification every week about the new publications in a specific keyword that you can choose. So if you are interested in a particular area, you just set up your platforms and it will send you a number of papers every week, every second week, or every month. For me, I just put it every month, so it's make it easier. 6, 7, 10, 20 papers published on that time, and that's it. But equally, I surprisingly using EndNote, which is a referencing platform, also help with my search, my literature review, and finally the Congress library, another platform. But PubMed, again, I've already signed up and I made a notification, which is super easy. You just get a notification every 1 or 2 weeks showing you exact. So rather than you go there and search for papers, no, it will do it for you. Just make sure you have a clear keywords in this search.
So Bilal, you had some comment?
Can I add? Yep. For the one who asked the question, just to clarify, PubMed is a platform that index the journals, the medical journals. So whatever article published in these journals, it will be indexed in PubMed. The main search engine for PubMed use the old school way of search, which use the query. And then you can set a query and you can set the alarms. It will send you updates whenever there is a new articles. The tools we are talking about is another version of analysis tools where you can upload your articles, the articles you have downloaded from many platforms, and then upload it to these platforms and start doing your research with, let's say, someone helping you. Okay, so I will call the AI as someone helping you. So don't let the AI do the job for you, but rather than use it as a double confirm, try to search for a particular information in the list of articles, try to find some general idea how to categorize the articles, how to do this, how to do that. So it is this is the way we use it. In addition to that, we have like Science Direct. Also, you can search for medical research in there. There are a lot of medical journals in there, and they have their own AI tools inside that Science Direct. So, and I'm expecting that Web of Science, PubMed, Midline, ProQuest, all of these search engines, they will have like 2 versions in the near future. One is using the traditional way, which is writing a query, and the other one is to use the question one. Right now, Google also developed their own Google Lab. So Google Lab is one search in Google Scholar. It helps you to search by writing details about what you are searching for, and it will rank for you the articles based on the information that extracted from the metadata of the data. So what I'm saying is that I believe that all researchers, they need to have some background about what exists. Then we will move to whether this is this is authentic, this is possible, this is eligible, this is not eligible. First, we have to know, and we have to know how it works and what can this tool do for us. Then we will discuss this issue. Thank you.
شكرا جزيلا دكتور بلال. Is there any other question? Or I think there is a lot of thank you from the audience, from Ghufran, from Sarmed, from Yasser, and from Midhat Al-Bazi. الأغلب يشكرون. وطبعا the presentation is fantastic. We're lucky that we recorded that. And we will make it available on the YouTube very soon. Thank you very much for all the presenter today. دكتور علي، دكتور بلال، دكتور أوس، فرصة سعيدة أن نلتقي بكم. وإن شاء الله الشهر المقبل راح يكون psychiatrist disorder on the 2nd of June, our next webinar. And إن شاء الله
the lead will be our colleague Zahra Al-Sultani, who's attending this. The lead for that webinar is Dr. Zahra Al-Sultani, consultant psychiatrist. She's joining us in this meeting.
وإن شاء الله يصير تعاون عن قريب فيما يخص أما كورس أو ورك شوب إن شاء الله.
حتى لو ما أعرف إذا أمكن أنه نشوف يعني list of links. مثلا هذا الجوجل لاب ترى كلش افكتيف، كلش يعني حلو، انا شفته بصراحه. فاذا دكتور بلال يشير هذني اللينكس يعني حتى يصير اكسس يعني accessible by many of our colleagues, make it easier for us to review.
هو اكو واتساب جروب او فد جروب مكان نشير بيه ولا بنفس الجروب؟
You could send it. You could send it.
If you want, you send it to this group.
Okay.
Right? And then we can put it through the general group.
Okay, wonderful.
The general group, both for the Iraqi Australasian Medical Association and the Academic Association. Remember,
okay, sure.
both will be.
Sure.
Yep.
Sure.
And we'll keep you updated. Thank you very much, guys. You made
well done.
Thank you.
Thanks so much. Thank you.
Thank you.
شكرا.